This video lecture is out of your ADA book. We are looking at Chapter 10, and we're going to be talking about dental patient scheduling. So, under the mechanics of scheduling, we're going to talk about the appointment book, the style, size, features, columns, whether we're using units or time blocks are all kind of dependent on what the dentist wants and what is best for the practice. We also might see some color coding, some tabs, and bookmarks being used. So for the appointment book itself, we have the option of manual or electronic. With our manual, it's going to be just a physical appointment book that is typically kept up front. It can be wire bound or loose leaf, and the pages can be predated or undated. So with our predated pages, we have ease of use. We can kind of look in and see what the date is and fill it out that way. Undated pages, though, we are really getting the most out of our manual appointment book because we can tailor it to the dental's the dental's days that they're open. With our electronic appointment book, we get the use of specialized features. So we can look at missed appointment tracking. We can tell for each specific patient if they've missed appointments in the past and how many times. We also can look at an up to date call list, or we like to call it an ASAP list. So these are patients who are willing to come in when we have cancellations. And we can do some other database manipulation. So we can run reports where we're looking at patients who have incomplete treatment, or maybe even patients who haven't used all of their dental insurance for the year. When we're talking about scheduling itself, we're going to ask ourselves a couple questions and keep in mind when our dental team is the most productive. So, when they are working faster and smarter, that might be when we want to schedule some of our big production appointments. And then we also want to schedule around the team to meet our goals. So a lot of times we'll break this down into monthly and daily goals and try to kind of tailor the schedule to meet those goals, but also not run our team so ragged. So some other things we want to keep in mind is how much time the dentist or provider needs to complete a procedure and which procedures might require extended function dental assistant, or maybe when the dentist would anticipate needing two hands, or if we need a hygienist to jump in at some point. And then we want to keep in mind too who is doing the majority of the scheduling, because they're really going to know the schedule in and out. So just kind of running by scheduling appointments with them might be beneficial. So some of our scenarios, the emergency patient. So we want to know when we're going to accommodate emergency patients because those happen quite often. Our patients who can only be seen in the afternoon, or even our patients who only want to be seen in the morning. Our chronologically late patient, so we need to know how we are going to handle that situation. Are we going to just schedule them a little bit earlier? Do we need to write a note in their records just to know that they are usually late? Patients who cancel, a student who cannot miss a school day, maybe a patient who arrives on the wrong day. So we want to know, are we going to accommodate them, or how are we going to de-escalate the situation if this does happen? And then an unscheduled appointment. So what happens if we are not looking at our appointment book? We're just throwing patients in wherever. We might have some patients who unfortunately will need to wait. If they need to wait all of the time, or they feel like they need to wait every time they come to the office, what they're going to start doing is showing up late. They're going to be offended that we're not valuing their time. When they come back into the dental treatment area, they might feel stress from us as the staff because we are running around. We don't have enough time for our procedures. And they're going to maybe start to question the quality of dentistry. When we're making appointments, we can do this by the patient calling in or us calling them. Or some of our appointments are going to be made in the dental office when we have our patients there for follow up treatment. So the patients can also schedule through a web based program. This is typically where they're putting in their information and what days and times work best for them. And then someone's reaching back out to them to get them scheduled. Or our patients who would schedule like 6 months in advance when they're there for hygiene appointments. Some of our time saving functions are going to include developing call lists. So these are those ASAP patients that I was speaking on earlier that are just able to come in at any time of day and just want to get the treatment done. We will maintain daily schedule sheets. So these will have the patients that are coming in, but we're going to remember to abide by HIPAA and keep all of the personal health information out of sight. We'll establish a daily routine. So typically what we're going to do is pull the patient's clinical records. We will review the procedures, make sure that what they're coming in fits the clinical notes from the last procedure. We will check their charts to make sure that they have everything signed, health history is updated. We're going to confirm the return of laboratory work. So if that patient is coming in for the seat of a denture or a occlusal guard delivery, we want to make sure that we have that in the office. We're not wasting their time and making them come to the office without having their laboratory work. We want to confirm or remind patients of upcoming appointments in the way that they like to be reminded. So if they want a phone call or a text message or email, we will use the call list to fill any openings in the day's schedule. We are going to type a daily schedule so we can pass that out to members of the staff. And then every day, typically, we have a 5 to 10 minute huddle. And what we're going to do there is just review the schedule and kind of look at where everyone's going to be at throughout the day and at the patients that are coming in to prepare.